and then the week one begin. So that induction week is called week zero. It's not counted as part of your 6 weeks that you should be there, minimum of 6 weeks. No, that's counted as week zero. Previously, it used to be two, but from our site, we did just 1 week. Then the following week is now your week one. You are done with the induction, and then you move back to your unit. All of us will now go back to our various units. Now, for the very first week, in my unit in the eye department, I was given like a guideline of what I'm supposed to learn from week one to week six. Now, it is not compulsory for you to learn this thing as it is stipulated, but why they are giving you the guide is so that they state out what is truly important to the unit, and then if you are able to finish one thing before the end of the week, you can go over to the other thing. If you are not able to finish it, then you can carry it over to the next week. So in my week one, the thing I was told to learn was to know the staffs, get to do intraocular pressures and visual acuity. Now these are things I was already doing, but theirs is a little bit different. Especially the visual acuity, the chart that I'm using is different from the chart we're using back home. So you'll be introduced, mind you, every procedure has a protocol. So you go through the protocol, the consultant protocol surrounding visual acuity, consultant protocol surrounding intraocular pressure measurement, then the paper form, that's the documentation, how you're going to record what, how it is recorded, the forms you should use, the kind of patient you do those procedures to. So you get to know all these things, and then you practicalize them. If you are able to finish it that 1 week, then you move to the next one the next week. Now, luckily for me, it's not like I'm trying to be boastful, but I'm really a fast learner. So as long as you have taught me what I need to know, I will always pick up quickly. But just in case I wasn't able to do it, it's not a must because I have 12 weeks, remember, to go through this entire process. So I wasn't in a haste. At the same time, I wasn't sleeping. So I continued like that for the first week. And by the end of the first week, I was able to do these two things. And when you're doing, mind you, I am under adaptation. I cannot sign and then submit because I do not have a pin yet. So if and when I feel comfortable on carrying out any of these procedures on a patient, I have to wait for a registered nurse who I was assigned to be under for the day. So after finishing, I write it down, and then she is also there to watch that okay, the figures I get is correct and everything. Then I sign, and he or she will countersign. I'm going to be using she because my department, we are all females. We don't have a male nurse in my department. So that was it for the first week. And then the next week, I was to start doing some scans. There are some common scans in the eye center, like the OCT. That is, if we have, let's say, 100 patients for the day, it is very likely that 80 of them will need an OCT scan. So you can see that it is a very important scan, and you have to know how to do it perfectly well. Just imagine if you are taking care of a patient and you are doing a scan, the pictures are not okay, and the consultant can't, see the true picture of what is wrong with the patient. Those things, they have to take it into consideration. So when it comes, just as I explained, OCT also has a protocol surrounding it. Each doctor has what they are looking for when they send a patient for OCT. So you have to follow all those things. Sometimes it's not just you knowing how to perform the scan, but knowing how to do it according to the patient you're attending to, according to the protocols surrounding that procedure, and according to the consultant that requested for that test, and also where the patient is coming from. Because in my hospital, we have like patients that are coming from outside, where sometimes you need to print out the results. So there are how you print them out, and you have to do it accordingly. So I started learning all these things from week 2, and then the next week I also have like so many scans to learn. We have lots of machines in my department. Now, when you do any scan, at the end of the scan, the nurse you are working with will have to go through it with you and look at it. Oh, this is how you would have done it. At the same time, if you keep making mistake, the nurse will take over, because it can't because you are there to study. They will now like delay the clinic, and or the patient will continue to be uncomfortable, and the nurse will just be there watching you. No, if she noticed that maybe I'm not able to do it quickly or finish it on time, because we have influx of patients very much in my hospital, she will just tell, okay, can you shift back? You shift back, and then she will take over and continue and finish with the patient. By that time, she has identified what you did wrong, and me myself, sometimes I already know what I did wrong or where I did not get it very well. Then as the patient leaves the room, I can now ask, oh, I was trying to do this, I've seen you do this before, I was trying to do it, but I got stuck here, I didn't know what to do, I didn't know this. She will now take time explain again. Okay, next time when a patient comes in, this is what you're going to do, this is what you're going to do, and then you continue. Now, at the end of my week 1, we have a learning log. We have a learning log. On the learning log, at the beginning of the week, you sit down with your preceptor, and then you set down your objectives. Usually the objective you're setting is based on the things you are supposed to learn for the week. So you set down the objectives, you have agreed, your preceptor has agreed, you sign, she signs, and then you keep it. So every day you start work on Monday. When you go to work on Monday, you finish. At the end of the day, you pick your learning log and you write what you were able to do that day, what you still need to improve on, and what you did well. Then you keep it. Next day, the same thing. At the end of the day, you write what you're able to do, what you need to learn more, and just like that till Friday. You now give it to your preceptor, who will those who supervised you throughout the week. They will go through it, each of the procedure that you were doing with them. They will comment on them on the learning log. Okay, Ndueso was able to do this, Ndueso needs to do more of this, needs to put more effort in social aspect, stuffs like that. Now, in each of the procedure you are going, somebody will be by your side while you're doing them. You can't be left alone, especially in the when you are starting off with that particular scan or procedure or something to do. They will make sure they are there with you while you do them. They will do it like 1 or 2 or 3 times, and then when you feel comfortable um to try, you can now tell them, okay, is it okay if I try it? I think I can be able to do this. And they're okay, no worry, when we have the next patient you can do it. So when the next patient comes in, they will allow you, okay, start, you continue. If you make mistake, they will take over and continue, just like that. But if you do it well, then the next patient you continue. Then when you get comfortable with the procedure, the preceptor can now stay one place and allow you to do, not really in dependent again, and not so full independence, you know kind of watching you from afar and letting you use your initiative to do it. At the end, she's still watching you, but she's not really interfering so much in what you're doing. If you're able to do well, then they can sign you off on that particular procedure and say, okay, she's now able to do this, she can do this with minimal supervision. That's the word, minimal supervision. And then you move on to the next thing. So your manager keeps getting reports from your preceptors. Sometimes my manager was the one supervising me, because we have different rooms and different things has to be done in different days. So sometimes maybe we're short, or the manager just wants, okay, since I've done this, that with so people, let her also see me do it. Then she will take over and then ask me to do it, and I will do them. And she also sees at the end of the week, she will also write on my learning log, okay, Ndueso was able to do this, Ndueso needs to do more, I supervise Ndueso to do this, and she did it with minimal supervision, with constant, but take comments like that. Whatever thing you do wrong, they will write. Whatever thing you do right, they will also write, and also give you um explanation on how you can do better.